Goedemorgen.
Ja.
Salut Kit, ça va?
Ja, zeker. Beetje onverwacht, maar dat ik nu deelneem. Wat was het probleem?
Maar je moet er niet in blijven, hè?
Ja, zo.
Wat is het probleem?
Ik weet niet, dat was het probleem.
Zat jij al in de meeting, Christophe? Want ik dacht dat jij wou testen met Shabani.
Ja. Maar ik wou nog even wachten, maar ik wou vooral vragen of dat ik al die meeting kan opstarten.
Ah, wel, ik kreeg ze dus niet opgestart en het is daarmee dat ik Tim erbij had. En ik zie nu op, ik had een reminder gescheduled gisteren om 2 uur om uit te sturen en dat werkt dus niet, hè, die automatische scheduling in Outlook. Dus ik ga nu nog snel een reminder sturen.
Die automatische wat?
Ik had zo normaal gezien, ik dacht dat je in Outlook kon zeggen, ik had die mail al gemaakt als ik die Mailchimp gemaakt had. Stuurt die mail morgen om 2 uur. En die is niet buiten gegaan. Heb jij een reminder gehad?
Dat is toch typisch? Is het een team? Is dat een coiffeur geweest? Heb ik gezien?
Heb jij een reminder gehad van die platform-meeting?
Nee.
Oké, dan ga ik je dat nu nog rap sturen naar iedereen. Our platform meeting starts.
Ja, Tim, zeg, maar ja, wacht even. Hè. Dus, wie moet nu mensen toelaten dan? Dat zeg jij dan, Michaela, of zo?
Oh nee, dus dat werkte nu niet. Het is daarom dat ik Tim gecontacteerd heeft.
Maar
misschien moet er wel bij blijven dan, Tim, om die mensen toe te laten.
Wacht, ik heb u nu host gemaakt.
Ja, wel, voilà.
Ja, ik wil host maken. Nee, maar ik heb nu geen rechten meer om dingen te doen.
Voilà.
Ja, Micha is nu host.
Nu zeg je de host, hè, Micha?
En ik nu de host, dus ik kan het toelaten.
Jij is de patroon.
Oké, de reminder gaat er nu uit.
Ja. Ik ga ook eens die Shabani contacteren. Hè.
Die was aan binnenkomen daarnet, maar die is...
Wel, voilà.
Maar hij is weg nu. Maar... Ik zie hem nu niet meer, want daar straks was hem weggegaan. Dus ik ga eruit proberen gaan. Ik weet niet wat dat gaat geven nu.
We zullen zien, het is een moment nu. Hè. Het is een moment om te proberen nu. Hè.
Ja, het is dat. Oké. Succes.
Zeg Tim, merci. Hè.
Ja,
Oké.
Salut.
Dag. Ja, inderdaad, fris geknipt. Ik had het nog niet gezien. Oké, yes. Ja, normaal is hij in. Nu hoop ik dat want die Mailchimp, als maar niet te veel mensen dat nu negeren natuurlijk.
Is er ça. Professor Shabani. Comment allez-vous? On vous entend pas. Hein? Si vous m'entendez, vous pouvez lever la main, s'il vous plaît. Virtuellement, bien sûr, parce que j'ai pas d'image non plus. Het is toch de moeite om dat nog een keer te proberen op voorhand. Hè?
Ja. Ja, ik was er gisteren aan het denken of wat je dat nu al gedaan had of niet, maar ik was niet meer zeker. Ik ga mijn presentatie ook even openzetten, maar ja, in die presentatie staat niks in eigenlijk.
Professeur Shabani, on vous entend toujours pas, vous savez. Je vois que vous êtes là.
Oui, je suis là. Je suis là.
Voilà. Je suis content de vous entendre là, parce que...
Ça marche bien.
S'il vous plaît.
Ça marche bien, oui, je suis là.
C'est bien.
Ok, c'est très bien.
Je suis content qu'on vous ait quand même réussi à vous joindre, parce que c'était pas facile. Hein?
C'est vrai, oui.
Dites les hommages de Kathleen. Apparemment, vous connaissez bien Kathleen Weutak.
Oui.
Voilà, c'est ma collègue, c'est notre collègue. Hein, donc, elle est responsable pour le Burundi.
Le Burundi, oui.
Sur ce point-là, en fait, moi aussi, j'ai été responsable pour le Burundi là, il y a 10 ans déjà. Hein. Donc, je ne vous connais pas, non, mais je connais bien vos collègues. Hein. Je connais Tadé très bien.
Oui.
En fait, c'est toujours la même. Hein. Jean-Jacques indiqué.
Oui, c'est vrai.
Je connais tous les gens qui sont impliqués dans le... Sauf Gaston. Gaston, je ne connais pas. Enfin, je n'ai pas encore vu.
Gaston, l'ancien recteur?
Ah, qui ça? Non. Il y a quand même encore un autre Gaston qui est maintenant responsable pour le projet 1, je crois. Donc, vous le connaissez quand même un peu, professeur Shabani?
Oui, c'est quel projet?
C'est le projet de VLUS. Donc, c'est le projet sur le CUI, la coopération universitaire
oui.
institutionnelle.
Oui, je connais. Vous avez 5 composantes. Hein?
Voilà, exactement.
Moi,
Gaston, là, non? Il n'y a pas de Gaston.
Je connais celui qui est à la faculté des sciences, Gaspard.
Ah, Gaspard.
Oui.
C'était Gaspard que je connais. Oui, Gaston.
Oui.
Qui ça? Oui, bon. Dites, quelle aventure chez vous, là, hein, avec les présidents. Hein. Oh.
C'est trop, hein. Mais maintenant, ça va se stabiliser.
Vous voyez, oui. Eh ben, espérons quand même, parce que bon, j'ai quand même l'impression que le nouveau président a quand même bien soutenu, quand même, apparemment. Hein.
Oui.
Et vous-même, c'est quoi exactement votre fonction, professeur Shabani? Parce que, bon, je ne vous connais pas non plus.
Moi, j'ai beaucoup de choses. Hein. Je suis d'abord professeur de mathématiques à la faculté des sciences.
Okay.
Mais j'étais entré à l'université, j'ai fait la carrière, je suis sorti pour aller à l'international, notamment à l'UNESCO. J'ai fait beaucoup d'années à l'UNESCO. Et puis, quand j'ai pris la retraite, je suis revenu et j'ai réintégré, enseigné à la faculté des sciences.
Vous êtes en retraite et vous travaillez toujours là ou quoi?
Oui, je suis là, directeur de l'école doctorale. Je suis directeur de l'école doctorale.
Ah.
Alors, au niveau national, je suis président de la Commission nationale de l'enseignement supérieur. C'est la commission qui accrédite les universités, les programmes des universités publiques, privées. Je suis aussi président de l'Académie des sciences et puis d'autres choses.
Oui, sans doute. Et quelle est votre connexion alors avec le Covid-19?
Alors, vous savez, comme le VLIR, il y a un autre projet du côté des francophones, ARES. Je suis le coordonnateur de l'ARES ici, au Burundi. Oui.
Donc, Midende, il est toujours là ou quoi, quand même, oui?
Non, Midende, il a pris sa retraite. Hein,
bon, vous aussi, vous êtes toujours là.
Mais moi, je suis là. Alors, donc, avec le réseau des universités de l'ARES, il avait été proposé qu'on essaie de voir si on peut avoir des activités dans le domaine du Covid. Alors, nous avons rapidement développé un projet à l'école doctorale et c'est de ça que je vais vous parler brièvement.
Okay. Parfait. Oui, on essaie un peu de voir quelles sont les possibilités. Jusqu'à présent, on a surtout invité des Belges, donc des gens de la Belgique, qui ont beaucoup de choses à dire, bien sûr. Mais on voulait quand même aussi avoir ce lien avec les pays partenaires. Et comme le Burundi, quand même, c'est assez important. J'essaye donc de contacter les gens dans ces différents pays, mais ce n'est pas évident. Parce que bon, les gens comme vous...
Ce n'est pas évident, parce que même ici, ce n'est pas évident. Moi, j'aurais espéré que la faculté de médecine soit beaucoup plus impliquée, mais non, elle ne l'est pas. Alors, les autres facultés non plus. Alors, nous sommes entrés dans ça à partir du fait que nous avons une école doctorale et il y a des choses qui se font, notamment dans le domaine de la recherche. Nous avons un groupe sur la modélisation des maladies, malaria, et la grippe. Et donc, on veut renforcer ce groupe en essayant de l'étendre sur le Covid, parce que les méthodes de modélisation sont plus ou moins similaires. Alors après, nous avons regardé, nous avons dit service à la communauté. Nous pouvons aussi faire des choses, surtout que nous avons une avance énorme sur les autres structures ici, dans l'utilisation des plateformes comme Zoom, pour donner des cours en ligne, pour impliquer d'autres collègues qui sont à l'extérieur. Et donc, c'est à partir de ça. Et la coopération avec ARES, qui voulait s'impliquer dans le Covid. Et donc, c'est comme ça que nous avons commencé.
Ouais, en fait, on devrait aussi quand même prendre contact avec la reste aussi. Hein.
Je crois, oui.
On oublie plus souvent. Hein. Dites, professeur Shabani, avant qu'on va commencer, est-ce que vous voulez partager quelque chose, un panorama de dia ou quoi, ou non, vous n'avez rien?
Non, je n'ai pas préparé de PowerPoint.
Bon.
Comme vous avez dit qu'il faut juste expliquer.
Pas de souci, pas de souci. Mais je voulais simplement savoir, comme ça, on ne doit pas partager l'écran. Parce que comme vous le savez,
Oui, c'est ça.
Il y a moyen de projeter votre présentation sur l'écran.
Oui, oui.
Ce n'est pas nécessaire ici.
Ce n'est pas nécessaire aujourd'hui.
Ça vous dérange de mettre en marche votre caméra ou, parce que bon, je suppose que la plupart des gens veulent quand même vous voir. Ou est-ce que ça prend trop de...
Attendez, je vais voir. Caméra, voilà.
Peut-être ça prend trop de bandes. Non, ça va. Ah ben voilà.
Non, ça va. Oui, je suis là.
Enchanté. Non, c'est tout pour faire la présentation. Peut-être les gens veulent quand même vous voir aussi. Hein.
Oui, c'est correct. Oui.
Ouais.
C'est correct.
Bon, on va attendre un peu. J'espère que vous restez en ligne là.
Oui, je reste.
Je vais un peu discuter avec ma collègue là. Comme ça, on peut mettre tous les points sur les i. Hein.
D'accord, très bien.
Is dat allemaal in orde dan? Hè?
Ja.
Oké.
Voilà, on te voit maintenant. C'est bon. Ok.
Hoeveel heb je al dingen gehad? Heb je eigenlijk al inschrijvingen en zo?
Ik heb dat niet meer gedaan hè, met die inschrijvingen.
Ja.
Omdat mensen daar toch niet echt heel fel op reageren. Dus dat is zo'n ding. Ja, wat ik denk we zouden moeten uitbreiden dat er sowieso meerdere zijn. Hè? Dat is dat fase 2.
Ja.
Ik kreeg altijd maar 2 of 3 mensen in dat formulier. Dus ja, dat haalt niet uit.
Oké.
Een screenshot.
Ah, professor Verbeke, u bent er ook?
Ja, ik ben ook aangekomen, ja.
Dat is leuk.
Donc, professeur Shabani, la présentation de préférence devait être en anglais. Ça vous dérange pas?
Non, pas du tout.
Ah ben, impeccable. Vous savez qu'il y a 2 jours, on a discuté avec le professeur Kibeya. Hein?
Ah oui, ok, d'accord.
Il était aussi impliqué dans des groupes de discussion au sud, comme on appelle ici, pour développer notre nouvel programme de 5 ans. Hein? Donc,
oui.
En quinquennal.
Ah, mais c'est bien.
Il s'exprime aussi bien en anglais, hein, parce que bon, pour vous, les Burundais, c'est pas évident. Hein, donc,
c'est pas évident, mais...
C'est la 4e, la 5e langue, hein, donc... Parce que les gens oublient souvent les Africains. Bon, ils parlent le français, l'anglais, mais bon, souvent, c'est la 4e ou la 5e langue. Hein.
La 5e, c'est vrai, oui.
Ah, oui, c'est vrai. Après le Swahili, je suppose aussi. Hein, donc,
le Swahili, oui, on parle le Swahili aussi.
Good morning.
C'est pas évident.
Good morning, Anouk.
Hello, morning.
Good morning.
Sorry, I was knocking on the door for some time.
Yeah, it's because I'm struggling a little bit with the controls, but now it's all...
Ah, okay.
It's all on. Oké. Doe jij de chat dan ook?
Ja, moet ik even kijken waar die zit. Ja, ik heb hem al gevonden.
Ja, het is zo terug even nu wennen met het is daarom, ja.
En Zoom had ook een update nodig, dus die had ik al lang niet meer gebruikt.
Ja, wij raakten eerst zelfs niet in de meeting. Tim moest ze starten. Oké.
Christine is er niet, hè?
Nee.
Ben je naar de kapper geweest, Micha?
Nee, nog altijd.
Mooi.
Nog altijd corona-haar. Good morning.
Morning.
Hoeveel mensen verwacht je?
Geen idee.
Ah, oké.
Helemaal open. Ik zei juist tegen Christophe, ik had die reminder eigenlijk die juist buiten is gescheduled in Outlook om morgen om 2 uur weg te gaan, maar dat is niet gelukt.
Ah, ja.
Dus daar kan ik niet meer op vertrouwen. Als ik eens ga zoeken wat dat is. Dus ik heb eigenlijk geen idee. Maar
Ben je aan het recorden? Ja. Hè?
ik hoop dat we er voor de volgende wat meer tegenaan kunnen gaan, namelijk.
Yes. Ja, ik dacht alleen wel toen Christine gisteren dacht ik, nee, niet nu.
Ja, ik zag het.
Ik ga mijn camera afzetten.
Good morning, all. We're gonna wait a few more minutes and then we'll start this meeting. Okay.
Hey Christine, ça va? Professor Michielsen.
Ik was stilletjes...
Gilly. Hey Gilly, hey, tof dat je er ook bent. Tof, leuk. Christine, ga je een presentatie geven of zo? Ik bedoel, met PowerPoint? Of,
Ik heb een paar slides voorbereid, ja. Dus ik kan, als ik het scherm kan overnemen zelfs...
wel, perfect. Ideaal.
Maar kort, hè?
Ja, dat was de bedoeling. Dat was zeker de bedoeling. We hebben ook maar een uur, dus...
Ja. Zijn er al veel dergelijke vergaderingen geweest? Ik heb dat een beetje...
Dit is de 5e.
Toch allemaal. Ja.
This is the... Maybe...
We'll switch to English.
This is the fifth meeting of this kind. And so far it's been quite successful, I must say.
Yeah.
Many people have shared their ideas and discussions have been conducted. And so we thought with all of you, then also to share your experiences with the COVID-19.
Yeah, we're working really hard, honestly, to try to set up quite a big study.
I'll
explain a bit more.
To hear about it.
Yeah.
And also, we're also keen to know what your needs are too. So to know what...
Money, Christophe.
This is the only thing we can't afford.
And help in translating the research to practice and policy, of course, that's also super important. And I think we could definitely use your help in this, or the group's help.
Okay. Bob Kolobunders is also there.
Yeah. I'll wait 2 more minutes and then we will start with the introduction.
Yeah. Okay. Good morning, Professor Kolobunders. How are you today? You're mute, so we can't hear you.
I'm fine, very well. Thank you.
Good.
I will mute again.
Okay. Professor Delgado, how are you today?
Not professor yet.
No, it doesn't matter. It doesn't matter.
Future professor.
So how is the situation in Peru now? Huh? Is it still?
Well, it depends. It changed from region to region. In Lima and in the Amazon now, they are doing better. But yeah, now it's some regions in the north of Peru where it's quite warm. Yeah, the cases are rising. But it's different. Peru is quite big. So yeah, it's on one side it goes down and the other goes up. So it's still difficult. But since this week, everything is, the economic activities are starting to go normal. So, yeah, people cannot wait too much, in low endemic areas. I mean, in these countries, yeah, it's difficult to have a quarantine and things like that. People needs to work, and they just work. We will see.
Yeah.
Okay, Micha, I suggest we start. What do you think?
Yeah, we'll start. Probably some people will enter the meeting while we are having the meeting, but that's no problem at all. So as every meeting, I will start with the guidelines for participation. I think you can see the screen. Most people are, in the meantime, used to do this online meeting, so I think there is nothing new here. If you want to say something, please raise your virtual hand. It's next to your name. You can raise your hand. And then if you are not speaking, we ask you to unmute yourself, but then also think about to mute yourself, but also think about unmuting yourself when you're speaking. The second slide is about that we are recording this online meeting. We hope that's for everybody okay. And what we are doing now since the last few meetings is that after the meeting, we cut out the little parts of the speakers, and these little parts, we will publish them on our virtual platform. So also people that were not in the meeting or that not attended the meeting have the opportunity to see your talks. If you don't agree with posting this talk, or if you want to see it first, just send me a mail, let me know, and then we'll take it into account, of course. And then I will stop sharing my screen and give the word to Professor Shabani.
Okay, thank you very much. Shall I introduce myself?
Yes, please.
Yes, good morning. I am from Burundi. I am a professor of mathematics and theoretical physics. I started my career here at the University of Burundi. Became a vice rector some time ago, I think 30 years ago. Then I left the country and joined UNESCO, where I spent 17 years in various positions. Retired from UNESCO, then I came back here. Now I'm teaching mathematics and physics at the Faculty of Science. I am also director of the doctoral school of the University of Burundi. This is the only doctoral school in Burundi. And at national level, I am president of the National Commission for Higher Education, which is in charge of accrediting new institutions and programs. And also I am the president of the Burundi Academy of Science and Technology. Thank you very much.
Okay, that's impressive. So please, yeah, talk about what you are doing in Burundi.
Yeah, well, now maybe when it comes to this program, COVID, I should say that we entered this program first from the research point of view, because we have a group, a strong group, which is dealing with the mathematical modeling of some diseases like malaria, which is a real problem here, and like influenza. So once this COVID appeared, we thought maybe we should try to expand our group and our coverage also to cover the COVID, and see how we could contribute from that angle, mathematical modeling of COVID-19. But then at the same time, we are working with, and I'm coordinator of the cooperation program with the ARES. This is the Francophone, you know it, Académie de Recherche et d'Enseignement Supérieur. I'm the coordinator here. The coordinator in Belgium is Professor Jan Bogart. So there was a proposal that we should also include this as part of our collaboration program. So we started some discussion and came up to the conclusion that we need to set up a program which will be jointly implemented with the universities of that network, but also with institutions here in Burundi, which are involved in COVID. And then from there, we also realized there is need to strengthen capacity at national level of those technicians which are involved in the detection of the virus at the national level, and also coming to this issue of production of hydroalcoholic solution to wash hands. We thought it will be good if we can also support young students to be involved in that kind of process. So I don't know whether I should go on and give a few details on this, or whether this was just introduction. You will tell me.
Please give a few details, yes. Yeah,
shall I continue?
Here are some of the details, yes.
Okay, fine. Now, the first program, we have 4 components. The first one, 2 are related to our services to the community. First one, as I said, there is a there is lack of capacity for the technicians to try to carry out the detection of viruses in the country. The whole thing was concentrated in Bujumbura, but now, and this was, we could anticipate that there will be also problem in the countryside, and this is now the case. The viruses now has spread into all the country, and there is lack of capacity to for detection. So what we are proposing here in Burundi, there is an institute which is called National Institute for Public Health. This is the only institute in charge of dealing with the COVID-19, but themselves, they don't have that capacity. So what we are suggesting is using this kind of technology, the Zoom platform, and we are using it very often in our doctoral school. We could see how to develop teaching programs and help those people to, you know, teach them how to use those equipment they are using, so that we can end up having a larger group of people with capacity to use those techniques and be sure they can carry out the detection process in the whole country. So we are working closely with that institute, and we are now, as I said, as I told Christophe, we are now in collaboration with this ARES network of universities, trying to look for partners who are developing
That's a pity. I don't hear Professor Shabani anymore. It's the same.
Neither do I. Neither do I. Professor Shabani, can you try again? I only have one project, one of all of the four. Okay.
Maybe he will log in again, because I see he's out now.
There is nobody else of the people that are participating involved in this Burundi? No, I don't see anyone who could possibly be aware of what exactly is happening there. Yeah, maybe.
I am involved in a number of initiatives over there with the INSP, so which is the National Institute for Public Health, and with Université Lumière. But I'm not sure. Oh, okay, he's back.
There he's back.
I am back. So the second component is prevention program for people who are working in those activities related to COVID. Some of them, while they are trying to do this, while they are trying to do the detection of the virus, themselves, they are infected. So what we want to do is to carry out an online survey to find what are the factor risks for to prevent them from being infected, and use that information to develop an online module. I think here we will involve a colleague from Faculty of Medicine and people from outside, and then carry out a program that will be also provided to the people who are working with those areas. So those are the two programs that we consider as our contribution to services to the community. The third one, as I said, is one of our programs. We have a program on mathematical modeling related to some diseases. We have, currently we have two, mathematical modeling for malaria and for influenza. And some of the methodology used, I'm told, are the same. We need to know what are the factors for risk which are related to prevention, to spread of these viruses. We need also to know what are the structures of social contact networks, and from there we can develop mathematical models that will give us the capacity to prevent, at least to predict, to know what may happen, so that we can better organize the process of detection of the virus. We have a group at the school, at the doctoral school, and for this specific one, we have a young colleague who was involved, who is currently doing some work for the World Health Organization. He was involved in the Ebola group in Goma, in DRC, and now he's here, and he has committed himself to help us in developing this model for the COVID-19 in the country. The last one is some kind of a support to youth for development of entrepreneurship. We have at the doctoral school, we have an incubator for establishment of enterprises, but currently we have it in the area of agribusiness. So we are helping teams of young people to start enterprises, giving them training and providing some support. So we want to use this structure to help young people to, in the process of production of the how do you call it? The solutions, production of this, the solutions that are used for hand washing. So we will recruit a group of people at that incubator, which is at the doctoral school, give them some training using some of the pharmaceutical companies here, using maybe labs, the Faculty of Medicine and Science, but also using online training to give them that capacity so that they can produce those alcoholical solutions for washing hands. I think you call them production of hydroalcoholic solutions. This is what we want to do as our last component. We were also trying to see whether we could produce some prototype of ventilators using our Faculty of Engineering and other colleagues, but I think people are not, most welcoming, so we thought we should not, for the time being, we should not consider that one. Although I know some universities like Kenyatta University in Nairobi, where a group of students, of course, with support from some partners, they were able to develop such a kind of ventilator that can be used in the process of COVID-19. There are other universities, but I think here colleagues from the Faculty of, we contacted colleagues at the Faculty of Engineering, Faculty of Medicine, but we have the impression that they are not very much interested in this. So for the time being, we will be limited ourselves to those 4 components. One is to develop capacity for detection. Second is prevention for those who are involved, giving them some training which will help them to prevent, to protect themselves. And then the mathematical modeling for the spread of COVID into countryside. And then this involvement of youth for production of hydroalcoholic solutions for hand washing. Thank you very much.
Thank you, Professor Shabani. Does anyone has any questions for Professor Shabani, or wants to give feedback, or has some information for him? Please raise your hand. Yes.
Sorry, I can't figure out how to raise my hand here. I don't see that icon.
No, it's okay. We are a small group, so it's okay to speak, Professor Verbeke. Go ahead.
I do have a whole list of questions and maybe also some information. I think this is quite interesting that an initiative is coming from the University of Burundi. Actually, for several years, I've been involved in collaborating with some other institutions. One of them is the INSP, which is the National Institute for Public Health, that has been mentioned by Professor Shabani. Another one is the Université Lumière, which is a private university in Bujumbura. And in fact, we have been working basically on digitalization tools for the health sector in Burundi. And since a couple of months, those tools, or some of those tools, have been focusing on COVID-19, although there were very few cases reported from Burundi, but still from what we could find in terms of symptoms and signs and diagnostics, also in the health information systems that we actually have active in Burundi. It's in about 24 hospitals that are using an electronic patient record system. We see that there are definitely more cases than the ones that have been reported officially. So this is a first point. There is already some kind of collaboration and some initiatives related to COVID-19, basically focusing today on two aspects. The first aspect is data collection. And so to have a structured data collection in the different health facilities. And so that might already be something interesting, because with another research group where we have been working also on mathematical modeling, we have seen that the WHO data that we get, certainly for sub-Saharan African countries, are not at all reliable. They really do not reflect the reality from the field, because there's under-reporting, there's also very selective reporting. In Burundi, there's a particular problem of the WHO being expelled from the country a couple of weeks ago. And so I would also want to know how are you going to handle that? Is there some hope that they will be coming back soon? So that is data collection. And another element is clinical decision support. Based on the data that is available, we have implemented already a series of clinical decision support tools in the form of specialized COVID-19 oriented clinical records, focusing on triage, admission and follow-up of patients. So these tools could probably also be used within a mathematical modeling context, because it's providing some formalized models and systems for collecting data and for guiding also the clinical users with regards to COVID-19. So this is a first element. A second element is related to the incubator. I think it's interesting because certainly in Burundi, the private sector is extremely weak, and not only within the health sector, but also for other sectors. And so being able to set up, it could be production plants for not only hydroalcoholic solutions, but also maybe also other personal protective equipment, like masks or other stuff. I would somehow want to send a warning with regards to ventilators. Personally, from what we have seen in Africa, I don't think ventilators are going to save a lot of lives. We are not going to save lives, I think, in Africa in intensive care units. It's on another level. What is far more needed would be oxygen, oxygen concentrators or production units for oxygen, and also very simple tools like pulse oximeters, where you can just measure the oxygen levels. And we have also started up with funding from Enable, the Belgian Development Agency, a project for producing very simple, robust equipment that also integrates pulse oximeters and that are really targeting sub-Saharan African countries. And we are going to start a project, an implementation and evaluation project in September in Burundi and a couple of hospitals. So I will be happy to collaborate on this also. So these are a couple of remarks that I would like to make.
Yes.
I raised my hand, but you haven't seen it?
Yes, now I see it. Now I see the...
Yeah, so very interesting both discussions from Burundi and also from Professor Frank Verbeek. I don't know your background, but I'm very interested in working with you maybe, because we're doing similar things as I mentioned in previous presentations. In many countries, we're collecting information on preventive behavior and also on people with symptoms, and we do that with online questionnaires. And in Burundi, we have Zakaria Ndizea from the Faculty of Medicine from the University of Burundi, who is doing that. But it was not so successful. They have so far only like 420 people who responded, because I don't know, the people have no mobile phones or no money to have internet time. So we need to find other ways to have more reliable data. So going out to the community and also ask questions like that. So we want to expand on that. I think it's important to have that information on preventive behavior of the population, whether they use masks, whether they wash their hands, etc., to put that in a model, because that's essential. To predict what will happen is that you need to have information on preventive behavior. And we need to improve data collection. I agree with Frank Verbeek that you can do a lot with the symptoms, and his system of getting information from the hospitals, if that information is digitalized, is extremely useful. Because we just have a publication that was accepted that in Somalia, we had, based on the symptoms, we discovered that there's a huge number of people infected. If you look at some symptoms that are very specific, like anosmia, you can have a clinical definition of this disease, and you don't need the test. The test can be used to confirm it and to have to validate your clinical definition. But you can do a lot with symptoms that you can get through online questionnaires or having collection information indeed in the hospitals. So I would certainly, after this meeting, to have the possibility to discuss with both of you, Frank, to see how we can collaborate. I know that in Rwanda also people are thinking about doing same thing, mismodeling, and getting the data from they collect about people hospitalized and mortality, but also preventive behavior, and put it all in a model to see how the evolution will be of this epidemic. And I think there is also, as you probably know, a call for funding from the Canadians and people from Sweden for artificial intelligence projects. And that I would like to know whether you are also participating. We were thinking also submitting something with that. And I think Professor Mark Tuwahirumukiriza from University of Ghent is also submitting a proposal in this domain. You certainly should invite him also one day to our meeting.
Thank you, Professor Kolenbunder. Marlene, I also have.
Yes, hi everyone, and happy to join and to listen in. I joined a bit late, but I wanted to make the same remark as what Bob was saying in relation to Professor Mark from Ghent University. I'm not going to try his name, but he, from Kenya, we already joined him on a submission, I think, to EU, a call from the EU. I don't remember now whether it was Horizon. I think it was Horizon some time ago. And so he and his network, if it is about data collection and artificial intelligence, are surely worth it to bring in. So thanks for bringing that, Bob. My other point is just some updates from Kenya, where we are working with also with Christine Michielsen, who will come later, I think, but on women's health, sexual and reproductive health, and the disasters. We are seeing that it's not only a COVID pandemic, but at least in this part of the world, also and in many parts, also a violence, rape, and teenage pregnancy pandemic going together. The gains we made over the last years are really down. So we have engaged in a number of national and regional and international platforms looking at that. We see so many, it's really alarming. The number of teenage pregnancies was already high, but now we have because of containment, we are still in lockdown, curfew, and so on. So there is a lot of sexual abuse, more than I have ever seen in this country in the last 40 years. So we try also to, if people want to join, please also reach out to Answer, to Christine, to us, because we are doing a lot of work in that area. Thanks.
Thank you, Marleen. Before we go over to Christine, maybe I want to ask like Professor Shabani if he has any reaction on what was said, or if he wants to react on all the questions and feedback.
Yes, thank you very much. First of all, I should like to thank those who made these comments, contribution, and so on. I was happy to learn that there is already some collaboration between institutions in Burundi and some in Belgium. For us, I think, as I said, we are with the Faculty of Medicine, we are in the same university, but there is no collaboration so far. And we are not aware of what is being done by our colleague Zakaria and Dizeye. Of course, here we have been using the online surveys, and it works. You cannot just limit it because people don't have connection. You should be creative and find other ways of using those forms. I carried out I carried out recently an evaluation of the new system in Burundi, and I was able to involve so many students because simply I was able to recruit students, give them those online questionnaires, try to train them on how to administer, then they will go discuss with their colleagues who will be giving the answers offline, but then this will be entered into the online system, and we're able to involve so many students. So I think they should, maybe they should try to, I don't know this person, but we can get in touch and see how we can collaborate and put our efforts together. Now, the data collection, I think this was a very important comment. Initially, data was available only at the Institute of National Public Health, and we are collaborating with that institute. But now, since the period after the elections, now all the hospitals are allowed now to admit people, to collect data, and so on. And we are going to use that opportunity, at least, to try to enrich the modeling we are trying to set up. Because even hospitals in the countryside can now admit, can collect data, and I think this is very, very important, and we will do that. I'm also happy with the comment on the incubator. Yes, I think we should try to look at all the prevention techniques, not only limit to the hydroalcoholic solutions. And then we must welcome any collaboration in this related to the 4 areas that I mentioned here. And we will be happy to work together with all these institutions which are represented here. Thank you.
Okay, thank you, Professor Shabani. And then I'll give the word now to Christine Michielsen.
Thank you, Michaela. Let me try to share my screen. I get a message that the host disabled participant screen sharing. So I don't know if you can press a button somewhere that allows me to share my screen.
Multiple, what should I do? Oh. You can do it now? Now you can share?
Try. Yes.
Okay.
So I think you should be able to see my screen now.
Yes.
Yeah, so thank you very much for having me over and inviting me to present the study in this group. As you mentioned, my name is Christine. I'm a professor at the University of Ghent. I work in the International Center for Reproductive Health, ICRH, which was founded by my professional mother, Marleen, who is, I'm happy to see on the call as well. And I'm here to present a study that that will soon be launched on the impact of COVID-19 on sexual and reproductive health, because as Marleen mentioned, rightfully, this is not only a COVID pandemic, it is a pandemic of violence, of maternal mortality, of rape. And since the beginning of the epidemic, we have been receiving all kinds of more anecdotal messages, information from different countries about the impact of the COVID measures on sexual and reproductive health. There have been reports of people dying from domestic violence, of pregnant women not reaching facilities to deliver babies, etc. There's the Secretary General of the UN who has also issued a call for attention to violence against women and girls. So we see a lot of negative outfall because of this COVID measures. At the same time, there are a few positive things as well. We also see that this may be an opportunity for HIV, to reduce infections of HIV and to get more people tested, because they have been locked down for a number of weeks. So there have been in several countries pop-up campaigns as well for HIV testing. So yeah, we saw these messages coming in late March, early April. And then we decided to, I sent out a mail. Well, I sent out a mail to a network that we have. There was a Thursday morning, early April, I think. And we have this network. It's called the Academic Network for Sexual and Reproductive Health and Rights Policy Research. In short, it's ANSWER. And it's a collective of about 38 academic institutions from around the globe. So I sent out an email asking if anybody would be interested to set up a study to measure the impact of COVID on all these aspects of sexual and reproductive health. And I received quite a lot of positive answers, amongst others from Kenya as well. So we started developing a survey. And then a few weeks later, I saw another email passing by from the London School of Hygiene and Tropical Medicine, who wanted to set up a similar survey. So I immediately contacted them, and we got in touch, set up a meeting, and we decided to move forward together from now on. It's Professor Joe Tucker from the London School who is leading the efforts from there. They also have a wide network in the field of SRHR, and several institutions that are in their network joined as well. So as it stands now, we have 33 countries who are preparing to roll out a study. I can say that this is really a global effort. We have partners in all continents. I think even not all are indicated on the map. I don't see Burkina Faso there yet. We also have Malaysia, who recently joined. So it's still expanding a bit, but as you can see, it's quite a wide range of countries that are committed to doing this study. And what will we be doing exactly? So we will do, Christophe, as I mentioned before, we don't have any money. So this is all voluntary work. Everybody is participating voluntarily without any budget. So the only feasible thing that we can do for now, and we hope to be able to expand a bit further in the future. So the only thing we can do now is an online survey with a convenience sample. And we will be asking questions on socio-demographics, socio-economics, as is done in most surveys, but also on the impact of the measures on sexual behavior, on access to reproductive health services, including contraception, antenatal care, abortion, on HIV and STI treatment and testing, on harmful cultural practices, and also including female genital mutilation and early marriages, and also on mental health. Some of the topics are optional. Of course, several countries don't practice. In several countries, female genital mutilation is not practiced, so they won't ask questions about this. But these are in general the broad topics that we are approaching. We have developed the survey with input from all the different sites. It has been field tested in 5 countries so far, and we are currently programming the survey in the ODK software. There's a study protocol that has been developed. It was submitted for publication last weekend. As I said, we have 33 countries participating, of which 27 have already submitted IRB, so ethical approval, and 8 have already received ethical approval and are ready to start as from next week. What I found really interesting in this effort, so we are, I think my mailing list is now about 150 people, most of which I don't know, or is the first time that we're working together. And it is, I find it quite impressive how productively everybody is cooperating, how constructively everybody is working together. We have set up quite an extensive study in only a few weeks. We are working in different working groups. People are taking responsibility. So we have a working group on survey development, on survey implementation, on technical support, on analysis. They're meeting every week with lots of peoples. We also have almost a weekly meeting with the working groups. We have bi-weekly meetings with the full consortium. And we have set up all kinds of both communication tools and project management tools online. And for me, it's really nice to see how this is really a global community coming together and collaborating very actively, very inclusively. It's very, very nice to see, actually. So here are a few of the tools that we are developing that will be used in promotional efforts. We also have a website that you can visit. So that is briefly in a nutshell what we are doing. Happy to answer any questions, and if you're interested to also join as a study site, please let me know. If you can help disseminate the survey in any of the countries that we are working in, that would also be very much appreciated. And we could also use some help in translating the findings to policy and practice in the different countries. So that's it from me. I'll stop sharing my screen and happy to answer any questions if there would be.
Thank you, Professor Michielsen. Any questions for Professor Michielsen? Desiree?
I have a question. Yes. Good morning. First, I thank you very much for having organized this video meeting. And I have a short question that I can address to Professor Shabani. Because I saw that in Burundi, the policy for fighting against COVID-19 is not the same like other countries. So I have a question before presenting my short project of the Nuta group that I lead. The question is how Juma Shaban and his friend are going to apply different measures against the COVID-19 when some government don't support their courage, their effort, because when a government don't support an idea of an individual person, it is not easy to protect a great number of persons. This is the question I have now.
Okay, thank you, Desiree. Professor Shabani, you want to answer?
Yes. You see, here in Burundi, of course, there is a policy, even if the policy is just a statement or some decisions to set up a structure and so on. Now, when it comes for detection of viruses and in this area, it is the National Institute for Public Health, which is approved by the government to do any type of activities related to that one. So we said, and we had a lot of meetings, a lot of consultation with that institute. We said, at the university level, we have 3 missions. It is teaching, it is research, it is services. And we see that with the capacity we have, using online platforms, using collaboration, we can help you to strengthen your capacity so that you can do better whatever is required, is expected from you. Initially, they had only 6 experts, 6 technicians for detection of the virus in the country. We said even those ones, we don't know how well they are trained. So we discussed with them and they accepted and they welcomed the idea that they are ready to work with us so that we can help them to develop that capacity. So this is what we are doing. And I think it is very well appreciated by that institute, by the ministry, and so on.
Okay.
And we don't ask anything from them. We are not asking from resources from them, not from funds, nothing. We just have these platforms like the one we are using now. We use the YouTube video techniques, and we have collaboration with people, not only in Belgium, but we have colleagues in Africa, elsewhere, who have really they master this use of these platforms. And then we said, let us put this at your disposal and help you to develop the capacity. And they agreed. So I think this means that the government accepts what we are doing. And we are also happy to collaborate with any other institution in the country which wants to go, to the same direction. Thank you.
Okay, thank you, Professor Shabani. Then I saw that Marlene also raised her hand before. Maybe a question for Christine?
Can you hear me?
Yes.
Yeah. So I just wanted to, I did it in the chat box to congratulate Christine on the work that she has been leading and doing, and great to see that so many countries are joining. And I would call upon our colleagues also that are around the table to reach out to their networks and asking them to join as well, because this is in the area of population health, women health, children. We also see here in Kenya a reduced uptake of vaccination programs. And I assume this is the reality in many countries. So please let us know, contact Christine or me or others so that we can grow this community. Thanks.
Okay. Thank you, Marlene. Anyone else? Christophe, yeah?
Yes, thank you. I was wondering, Professor Koenen, are you involved in that research with Professor Michielsen? Or are you interested, or are you willing to support? Or I'm just wondering. because you also specialized in this type of research.
Yeah, hello, Christophe. Yeah, I already mailed to Christine privately in the chat, so I didn't address it to the whole group, but yes, it's a very impressive study, I think. I know the MUST is involved because we have a team project together, Christine and I, but I'm not directly involved in the study for the moment, but I think there are possibilities to, yeah.
And you yourself, are you doing something on COVID-19 right now?
No.
Not yet.
But yeah, we'll have a look on it because maybe we can help also with contacts and yeah.
Yeah, we are an open network, so everybody's still welcome to join. As I mentioned, we did start out from the network that we have, the Answer network, as a first group that we already have, but very welcome for other people to join. What we have not been able to do yet, and this is really because of lack of time, is to set up the study in Belgium as well. So I've been coordinating this in the overall for the 33 countries, which means that there was really no further time for me to really set it up in Belgium. So if there's any partners who would be willing to do that as well, that would be nice. Then we also have some comparative data that includes Belgium. And
Christine, are you active in Burundi too, or is that not on the list yet?
No, Burundi is not yet on the list. So I can put off the, I'll share the list with everybody. We have a website as well.
Would you be interested in taking up Burundi in the list, or is not yet?
We're open to everything. The only issue is that so we don't have any funding. as I mentioned, and we are taking up quite centrally quite a lot of tasks. So the countries themselves are responsible for translation, for ethical approval, for dissemination of the survey. But we are doing the coding of the survey ourselves to have it a bit centralized so that it's comparable. And yeah, the further we want to have as many countries launch as soon as possible. So if some countries are just starting now, they still need to go through the ethical process, which takes a few weeks and would only be able to launch probably late August or so.
Maybe Professor Shabani has some money there to spend.
Yeah.
Yes, I would like to say that we should like to join this network because we have some students doing PhD research in that area of sexual, reproductive, and so on. We don't need funds. We have our own resources to participate. So if this is agreeable, I will send you a short mail just to confirm that and give you the contact person in our university, in our school.
Super, thank you.
Thank you very much.
And Christine, is Peru involved? Because maybe Professor Delgado is interested there?
No, in Latin America we have Argentina, Colombia, Ecuador, and is it now Paraguay? Paraguay, yeah. Okay. And in Central America we have Panama as well, but Peru isn't for the moment.
Yes. I have a very good contact in Brazil. It's a lady, an epidemiologist, who certainly would like to join.
Okay, please send me her contacts. Thank you, Bob.
Yeah.
Yes, indeed. I will also share the information with my my colleagues in Peru. I think they would be also very interested to join.
Very nice. Very nice. Thank you.
Super.
More work.
I have a last question actually for Dieter Roefs. Because Dieter, you mentioned there before you were interrupted, of course, that you were also active in Burundi, and there's a lot of information going on, and apparently on collecting data and etc. Can you ask some questions or maybe provide some expertise that our Burundis and both our Burundis and our Belgian friends can use? Actually, are you in touch with Christine, Dieter? Dieter, are you there? Oh, he's not there. Okay.
Okay, then I'm gonna ask Desiree again. He wants to present his project. Desiree, you can take the word.
I am a representative and the leader of the NATO group, a group of refugees in the Mahama camp to facilitate, to put in enforcement different measures related to how to fight against COVID-19. And our project is to help to do mobilization, to do sensitization on the great importance to wear face masks. In Mahama camp, UNHCR helped by distributing face masks to more than 70,000 refugees and in different areas in Rwanda. What we do, we try to explain to different refugees in different communities, because we live together, in order, for example, to take face masks, to put it when you arrive at home. We must draw on in house to show how they can keep the masks. So I have this idea, but the problem we have is that sometimes we don't have money for buying some materials like whiteboard, so and so on. So if possible, we would need Shabani, as we published our project on the Digital for Development platform. We need at least 140,000 per month in order to work. But by waiting for any support, we continue to work. And I want that we could continue to do together with others around the world in order to protect population, in order to fight together against the COVID-19. Thank you very much.
Thank you, Desiree. I don't know if anyone has a question or feedback for Desiree.
Professor Kolbunders, don't you have any materials there in Yetik anymore that you can use?
Material for what?
Materials that Desiree is asking for, masks.
Masks, yeah, I'm in favor of distributing more masks, yes, but yeah, but I have no funding for that. So we were trying to write proposals to get more masks, but yeah, if there is a FLIR project in Rwanda, it doesn't need to be so costly. I think the FLIR should allow some money to be spent on producing masks and distributing masks and promoting the use of masks.
Mm-hmm.
Yeah, I fully agree. And also with your colleague Jean-Pierre, who is still active in Burundi. So there should be some possibilities there in helping this.
Yeah, I think some of the money could be used.
Yeah.
In this respect, I have a problem with Tanzania and my FLIR projects there. Tanzania also they got out of WHO and they don't accept the president, as you know, is not accepting there's any COVID in his country, so nothing is done. Even if you wear a mask, you can get in prison. So he doesn't want to hear about masks, so we can even not do anything about it. So I have really an ethical problem. So we should report on this, but you will get very. It will not be accepted by the government if you make noise about it. But can we stay silent? I also I don't understand why Burundi, the WHO was kicked out. So I think these are two major issues that need to be addressed.
Okay.
Maybe Professor Shabani, do you want to reply on that, or do you leave it?
No, because you see, when they were that decision was taken, there was no explanation. So officially, we don't know what happened.
Okay.
And it may be risky to try to carry out your personal analysis and explain things that maybe you don't understand.
Okay. There is one person I haven't heard yet, Professor Mikkonen. Are you there?
Yes, I'm here. I'm just listening and enjoying the discussion. Thank you very much. I have no really some point to raise at as a Jimma, but all the issues.
Are you from Jimma University?
Yes, I'm from Jimma University. I just joined because of my interest, and truly I'm enjoying all the discussions and contemplating with our situations. That Ethiopia, the case is increasing really about mask issues. What type of or quality of mask is another issue where we are discussing as an advisory for the region. But I'm just listening really, and we don't know where we are heading, but it is a good discussion. Thank you very much.
Okay, sir.
Thank you.
Okay, Micha, then...
I think it's 11 o'clock. I think we can end the meeting. It was really nice to host this meeting again. Again, a very good meeting, I think. And I hope to see you all next time. If somebody needs like some more information about someone else to contact them privately, just let us know and we will, of course, bring you in contact so that you can share by mail or chat or anything. All things that are possible nowadays. Thank you all for joining us.
Thank you.
Thank you all.
Bye.
Thank you very much.
Thank you. Bye-bye.
Shabani, Professor Michielsen, thank you very much.
My pleasure. Thank you.
Bye. Thank you.